Good evening. Thanks for joining us. I'm Heather Armstrong. There is never a time when knowing how to save a life isn't important. Heart Month has passed, but medical experts say we should always know what to do in a life and death situation. And as News 19's Rianne Weil tells you, while learning how to do CPR is important, learning how to operate an AED can mean the difference between life and death.
An AED, or an automated external defibrillator, is a kit designed to help bystanders during cardiac arrest. It can be used in conjunction with CPR to help properly assist victims while waiting for emergency responders.
It delivers a jolt of electricity or energy that shocks their heart back into a normal rhythm.
Wise says AEDs really do help save lives.
The thought was that CPR is one of the primary interventions that is going to reverse that cardiac arrest. And what the evidence has shown is that it's actually defibrillation, early defibrillation specifically, that is that beneficial intervention.
But that doesn't mean you shouldn't perform CPR.
AEDs are a significant factor in pre-hospital saving people, but people still need to do compressions because we need to move the blood around the body with the oxygen to keep the brain and the vital organs operational, functional.
AEDs can seem a bit intimidating, but they are not difficult to use. They come with automated instructions that explain exactly what to do, step by step.
Apply pads to patient's bare chest. Plug in pads connector, analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange shock delivered. Paused. If needed, begin CPR.
Emergency responders suggest downloading the PulsePoint app.
It is a combination of two different apps. There's the PulsePoint AED app, which is that public AED registry, and there's also the PulsePoint Respond app, which is an app that anyone in the public can download and affiliate themselves with Tri-State Ambulance. And that will allow them, if they're nearby public cardiac arrest, to be alerted to that arrest and respond as an emergency responder to initiate CPR and use a defibrillator if it's available.
Members of the public that are aware where AEDs are can submit their locations to the app as well. Here's some advice for those who are nervous about using an AED and performing CPR.
Take a deep breath, then start your CPR, start your compressions, and make sure that 911 is called and get an AED. Trying something is better than nothing. And you can't hurt a person who's already dying. I mean, if they don't get help, they are going to be dead.
In La Crosse, I'm Rianne Weil, News 19.
Both La Crosse and La Crescent are heart-safe communities. That means 15% or more of the population is prepared to improve outcomes to sudden cardiac arrest emergencies, including using AEDs, setting them up all around the communities as well. Now, ambulances can loan out AEDs for public events and people who want to learn more.